Hi, and thank you for your interest. My name is Dan Roberson. I'm a resident physician in urology at the University of Pennsylvania, and I'll be presenting our exciting and novel outcomes from the Patient Report of Intermittent Catheterization Experience study. The study was funded as an educational grant from the company WellSpect. We know that patient satisfaction is an important indicator of quality of care and is paramount to health-related quality of life outcomes. In United States populations, the intermittent self-catheterization patient experience is poorly understood, as the majority of contemporary studies are retrospective and done in small populations outside of the US. That being said, existing work has suggested that patients perceive intermittent self-catheterization to be easy and to increase quality of life. We have also learned from these studies, however, that there is tremendous apprehension about initiating intermittent self-catheterization and fear of causing urinary tract infection. We hypothesize that through a better understanding of patient attitudes towards and practices with intermittent self-catheterization, health-related quality of life and overall quality of care can be improved. This is a cross-sectional, multicentric study conducted in a prospective manner at 6 distinct urology practices and rehabilitation centers throughout the United States. Eligible patients were English-speaking men and women who were 18 years or older and had been performing intermittent self-catheterization independently for at least 6 months. We collected demographics, general medical history, and an in-depth urologic history. We also administered a detailed intermittent self-catheterization personal practice and habit questionnaire. To quantify health-related quality of life, a validated questionnaire, the Intermittent Self-Catheterization Questionnaire, or the ISC-Q, was administered. The scoring of this survey is subdivided into ease of use, convenience, discreteness, and psychological well-being. A detailed breakdown of results can be found in the associated tables in our abstract. I will briefly highlight some of the more interesting findings. Across our 6 sites, 200 participants were included. 70% were male, 73.5% were Caucasian. Nearly 90% of patients were performing intermittent self-catheterization for 1 year or more, and nearly half of our participants were performing self-catheterization for 5 years or more. More than 50% of participants had a diagnosis of urinary retention as a result of a spinal cord injury. The overwhelming majority of patients use single-use catheters and do not require assistance with catheterization. We note 44% of participants experienced a recent UTI, which we defined as a UTI treated with antibiotics in the 6 months prior to enrollment in the study. The intermittent self-catheterization questionnaire results are on a scale of 100 points. The overall satisfaction score in our population was 70.4 points. The calculated satisfaction scores for each domain were as follows: ease of use, 82, discreteness, 75.4, psychological well-being, 64.3, and convenience, 60. Patients responded most positively to feeling confident in their ability to perform self-catheterization, and that catheters are easy to use and discreet. We learned that traveling with catheters, and more specifically carrying a large enough quantity supply for travel, is a concern for participants. We also learned that many participants are self-conscious about their reliance on intermittent self-catheterization and are concerned about the long-term effects of self-catheterization on their bodies. Due to the relatively large size, prospective design, diversity of participating practices, and use of validated surveys, the PRICE study is unique and well-positioned to answer important questions in the field. We note variability in catheter type, frequency of self-catheterization per day, and UTI experience. It is important for providers who treat this population to appreciate how different these patients can be. We found commonalities as well in our participants. Dependence on self-catheterization is chronic, which highlights the importance of understanding the quality of life impact this practice has. We can conclude that participants find catheters easy to use and to use in a discreet manner. Confidence in the ability to use the catheter is important for all intermittent self-catheterization patients, and our success with this thus far may be the result of successful patient education as well as successful catheter design. In our future work, we plan to use the findings from this study to discover ways to improve the health-related quality of life of this population. Further study is needed on methods to improve convenience while traveling for these patients, as well as understanding the long-term sequelae and implications of intermittent self-catheterization. We plan to look at what patients who have more UTIs have in common and how we can modify these patients' risk factors for UTIs. We also have data from a second validated quality of life questionnaire, the Intermittent Catheterization Difficulty Questionnaire, which we will report in future work. I appreciate your attention and look forward to engaging with you on the online forum. Here's a list of references.